Not everybody that presents with hip pain is going to have an advanced arthritis type of issue. In my practice, I also treat hip pain that turns out to be a condition called hip impingement. Hip impingement can be a process by which flexion of the hip will provide internal rub between the ball and the socket. That condition is essentially a genetic formation of the ball head, where there can be some prominence of bone that is leading to some internal rub. That internal rub can then later on down the road can lead to a labrum tear. The labrum, which you may have heard of from labrum tears in shoulder joints, is similar in the hip joint, albeit it is different. The labrum in the hip is a small soft tissue extension around the periphery of the socket, and over time that labrum can be damaged by internal hip impingement. So between x-rays as well as an MRI, we can diagnose hip impingement and potentially see a labrum tear that might require some intervention. Treatment for hip impingement or an acetabular labrum tear includes hip arthroscopy. This is one of the subspecialized procedures that I perform in my practice. Hip arthroscopy is an outpatient arthroscopic procedure done at a surgery center with typically 2 arthroscopic portals around the hip, one in the front and one on the side. With the hip arthroscopy, we can address labrum pathology through either a labrum repair, or if the labrum has been damaged but not quite torn, it can be cleaned up with our arthroscopic instruments. Most importantly would be to eliminate the cause of the labrum tear, which is often the bump on the side of the femoral head, the excess bone that may exist in somebody that is providing for the internal hip impingement. We do essentially a decompression of that bone bump, which is called a femoral osteochondroplasty, which we burr down excess bone to allow more range of motion of the hip joint. That protects the labrum repair, and it also helps to preserve the hip so there's not eventual scuffing or even eventual arthritis creation of the joint itself.